Welcome, 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 and thank you so much for joining us for this orientation webinar on the United States Conference on HIV/AIDS. You'll have to excuse me, my internet just went out for one quick moment, but I'm hoping I'm back. And one of the things that I wanted to say to you is that part of why you're here today is to talk about and give us feedback on what you want to see at this year's United States Conference on AIDS. For us, it's going to be critical and essential that we build a meeting that is based on pieces that you want to see and want to hear about. This webinar is going to be broken into 3 sections. The first section is going to be me, and I'm going to be talking about the content of the 2020 conference. Then Tara is going to speak, and Tara is going to speak on the platform so that you'll have an opportunity to experience a virtual conference. However, this is not the final platform that we're using. And then finally, we'll open it up to questions and answers so that people can ask questions about what they, what are their concerns and what they want us to make sure USCHA covers. But before we do that, what I'd like you to do, if you don't mind, everybody, is go to your GoToWebinar control panel. And in the GoToWebinar control panel, you'll see a thing called questions. What I'd like you to do in the question section is put your name, your agency, if you work in an agency, and your city and state. We just kind of want to know who's joining this call. You should know that close to 400 people have registered just to be on this call today. And so, Chip, have we started to get some names?
We have Lane Snow. We have Gwen Taylor, Ruben Vidales. We have Laura Mattis from Philadelphia. Kunani Dreyer from Hawaii Health and Harm Reduction Center in Honolulu. We have Brian.
Wow,
we have Brian Manalga from Legacy Project in Seattle. We have George Kerr from DC. Tatiana Ash from Howard Brown in Chicago. Erica Tecampi, HIV Care Directions in Phoenix. Brenda Fields from Southern Regional AHEC in Fayetteville. And Jorge Mazdu, I'm sorry if I'm butchering names, my apologies, from San Ysidro Health, and a lot of other folks who are joining us here today.
Well, thank you all so much for joining us. The 3 women on I guess it might be your right or left, are the people who really run this meeting. And so I wanted you to have an opportunity to meet them. We'll be putting their email addresses in the question section, in the chat section of this box, because I want you to be able to reach out to them at any time and never email me, but reach out to all of them, and they will help you, because I know they're very efficient. So Tara, why don't we start with introductions, and Tara, introduce yourself.
Hi everyone, I'm Tara Barnes-Darby, the Director of Conferences at NMAC, and I'm glad you joined us today. Thank you.
Good afternoon. I'm Alice McKeithen, the Conferences Manager, and I'm so glad everyone's here. Thanks for working with us and getting this virtual platform together.
Hi, my name is Shantae Gray, the Event and Registration Coordinator. You probably hear from me with all the emails. They all came from me. Welcome, welcome, welcome. Thank you.
So thank you. And I said this at the end last time, but I should say it really at the beginning. And I think they know this, but I think it's always important to say how much I appreciate their leadership and how much I know that this conference happens because of the 3 of them. I know you probably, people think we have this huge teams. It is 3 people who put on the United States Conference on HIV/AIDS. And they do it with, as you can see, a smile on their face. They've been doing it for many, many years. Tara, what year is this?
I believe it's the year 24, but I have to say we have plenty of partners, so very grateful.
And we couldn't do it without the partners, and we couldn't do it without all of you. And so part of why we're doing these webinars is we want to get people onto these different platforms so that they can be comfortable with this virtual learning format, because this is new to us. I'm not going to pretend to anybody that we are somehow an expert in doing a virtual conference. Let me be very, very honest and tell you that this is our first one. And like all of you, we've had to learn how to pivot our services to meet the new realities of COVID-19. We're going to do the best that we can, and we're going to try to bring you the excitement that NMAC conferences always have. But I also want you to know we're going to look for a little bit of understanding and forgiveness as we try to work through this together. So with that said, I'm going to get started. Oh, just what you want is my thing. Just one second. Okay, can you all see? Oh, no, you can't see this. Okay. So this is the logo for this year's conference. It is on October 19th through the 21st. What's important to acknowledge about this is that even though it is on those dates, it does not mean that you'll be able to view the material and the content that was developed for up to 12 months after the meeting is over. So even if you aren't able to join us on those dates, the content will still be available. What we've done is we put together kind of a strategy book. And when we first started this book, we really wanted to look at how COVID-19 has impacted the delivery of HIV prevention, treatment, care, and wraparound services. And while that's still a primary focus of the meeting, we also recognize that the last 2 weeks have really changed the world, and that we now want to look at HIV services in the context of not just COVID-19, but also Black Lives Matter. We understand that HIV is disproportionately, in fact, the majority of people living with HIV are people of color, and that we have a reckoning as a movement to how do we address that in a meaningful way. And so the conference is going to look at the intersection of COVID-19, Black Lives Matter, and the provision of HIV/AIDS services, including prevention, care, treatment, and wraparound services. The 2020 meeting is going to have 5 plenaries, 60 workshops. It says 12 institutes here, but I think it's probably closer to 20, and a virtual exhibit hall. Now, what I need to own here, and part of why I said this earlier, is we're being extraordinarily ambitious. You know, someone said to me, well, you should learn how to walk before you run. Well, we're doing a marathon. Forget the walking. We're going to go for it. And we're going to go for it with the 5 plenaries, 60 workshops, 20 institutes, and virtual exhibit hall, because we know that right now people need this information. Right now, so many of us are sitting here trying to figure out how do we provide services in this environment. One of the new things that we're doing this year that we're very excited about is we're going to be doing a virtual HIV jobs fair. You know, when we put this together, it said 40 million people were unemployed. I was reading this morning that that number is actually closer to 47 million people. You know, and unfortunately, too many of them are furloughed or laid off from nonprofits, particularly HIV nonprofits. And so with all this unemployment, we felt it was a particular responsibility to bring together job openings within our movement with people who need jobs. And part of why we're talking about it now is that for our ending the epidemic efforts, there's going to be about $300 million new dollars put out in the field. That should translate into thousands of new jobs and hundreds of contracts for community-based organizations. And so our goal is to bring together those communities to have that discussion about what's it going to take to hire people who've been really hurt by COVID-19. So this is the big thing, and I want to thank all of you for joining us. The conference is going to be free for the first 4,000 registrations. Someone at the last webinar asked me, well, what happens to 4,001? And what I said is that we will get back to you when we get to that number. We will not be charging, though. We just have to make sure that our platform that we're using the conference on can hold 4,001 people. What I want you to know of why we did this, because a lot of people have been asking, why have you decided to do the conference for free this year? And you know, we are part of the same movement that all of you live in. We understand the pain of what's happened in the last couple of months, and particularly what's happened in the last couple of weeks. And we wanted this to be free because it felt really tone deaf to ask for money during these difficult times. Now, I should tell you that even though it is free, you will be getting a donation request from me, and I expect all of you to respond with wonderful checks in support of NMAC, because we do need your support. And like all of you, NMAC is hurting now. You know, and like all of you, NMAC has real concerns about what the future is going to look like. And so we're doing it for free this year because it seemed tone deaf not to, but please don't take that to mean that we aren't in the same boat as almost all of us, because we are. The primary focus of this year's meeting is going to be on COVID-19. In what we've been talking about, we are going to be prioritizing trainings that help the HIV community manage what COVID-19 has meant to HIV prevention, care, and treatment. And part of what we mean by that, it can go all the way from how are we going to reopen our offices? You know, right now, many of these workplaces are opening back up, but are we ready to ensure the safety of our staffs? That's got to be a primary concern. And at the same time, how do we provide services for clients who desperately need them, who may have, you know, during COVID-19, not gone and done their blood work, not gone and seek some of the support programs that the wraparound services are offering. And so I think that this is going to be a real critical discussion. But the only way this discussion is going to work is if you, the people in the front lines, share your stories. You know, this conference works because people on the front lines tell their stories and tell us what it's like to provide HIV services in this environment. Because right now, nobody knows. Right now, we are all guessing. We're all trying to do our best. And so this will be an opportunity to hopefully learn from each other, identify some best practices, and really move forward as more and more places are opening up. So the 2020 theme is Family Reunion 2. We have decided to move back to a theme that we used in 2017, because right now it just feels like more than ever we need our family. More than ever we need, you know, USCHA is a family reunion, and NMAC sees family as more than blood. You know, family is the people that you want to hug when you have to be socially distant. Family are the people who you miss so much because they got your back. And so we want to celebrate that connection. We want to celebrate that commitment. And we want to go back to remembering that we are a family. So let's talk a little bit about the plenary sessions. The plenary sessions are going to be pre-recorded. And I want to just own that up front. They're going to be pre-recorded. They are not going to be live. And it was just a practical decision for us. We were very concerned that we would have 4,000 people online looking at their computer screens, and we would have some technical issue going live. And so at least for this first year, we've decided to pre-record all of our plenaries. They will be 60 minutes long. If you miss them, you will be able to catch them afterwards. There will be 5 plenaries this year. NMAC is responsible for 2 of them. We're doing the opening plenary on family reunion, and that is going to look at the intersection of HIV, COVID-19, and Black Lives Matter. The closing plenary is going to be a federal plenary, and we've invited our federal partners to come and talk about next steps for ending the epidemic efforts in this new environment. I am pleased to announce that Dr. Fauci has agreed to keynote this plenary. He's, as many of you probably know, been an extraordinarily good friend to NMAC, to the conference, and obviously a hero to this country. We have 3 other plenaries, and they're going to be provided by industry. And let me own up to why we're using industry, because I think it's important to understand. One of the only way that NMAC could do this conference for free was because our sponsors decided not to cut their 2020 sponsorship of this meeting. And so we're very thankful to them for not cutting their sponsorship levels and for continuing to support USCA, even though we're going to this new format that people don't know what's going to happen. And so right now I should tell you that Gilead is the presenting sponsor, and we'll do one of the plenaries. ViiV will do another one of the plenaries, and then we have 1 slot that is still open that we're talking with other people about. So the workshops. This is the substance of the conference. This is the piece that when we get later on, we'll talk about, and we will ask you to please consider submitting abstracts for this year's meeting. We're doing 60 workshops. There will be 4 workshop sessions, so there will be simultaneously 15 workshops happening. Now, I know that that sounds crazy. And so part of what we wanted to do in order to make sure that at least the content is there is we are pre-recording the first 30 minutes of the workshop where the data will be presented. And then the final 30 minutes will be a live Q&A, or at least we hope it will be a live Q&A, where, you know, this is all new to all of us. In terms of the tracks, these are the tracks that we have this year. We're doing one on race. We're then doing a federal track. We've met with all of our federal partners, and they're all very excited to participate. We're doing HIV prevention during COVID-19, HIV care and wraparound services during COVID-19, the next steps for ending the HIV epidemic, reaching communities hardest hit by HIV. That could be people over 50 living with HIV. That could be Black women. That could be the transgender community. We anticipate that this will be a fairly large track. We're looking at HIV policy, HIV community organizing, and finally, as an acknowledgement that we should have been in Puerto Rico, we've decided to do a Spanish language track this year. This is a first for the conference. We are excited to not only do a Spanish language track, but we are also going to be doing some simultaneous translation of the plenaries. This will not be a bilingual conference, but we will have places where there will be Spanish. I also just want to talk about the institutes. You see 14 listed here. Actually, the number is probably closer to 20. NMAC will be doing the typical racial and ethnic institutes that we've been doing, as well as for communities hard hit by HIV. We've added 2 new ones this year. We've added one for heterosexuals. We're very excited about this one. This is really based on advocacy by many heterosexual people who attend USCA, particularly heterosexual people living with HIV, who felt like there wasn't a spot for them at the meeting and really came to us and said, listen, you know, if this is going to be the United States Conference on AIDS, then you need to create a spot for us. Additionally, we've also added an institute on transgender men. Similar to heterosexuals, transgender men came to us and said, you know, there is a huge difference between transgender women programming, which we have been doing for quite a while, and programming for transgender men. And so we've also added an institute on transgendered men. Additionally, all of the partners who help produce USCA will also be doing institutes. So that means, for example, NASDAD will probably do something on hepatitis. NCSD will probably do something on STDs. And so when we get to the end and we talk about the workshops and the institutes, what will be really important for us to hear from you is what are the topics that you want to make sure that we're covering? Why do you come to this meeting, and how can we make sure that the work that we're providing is meeting your needs during these times? And the final thing I just wanted to say and wanted to remind everybody is that NMAC remains committed to Puerto Rico. We were extremely disappointed that we could not hold the meeting there this year. You should know that we have officially rescheduled it. It will be October 10th through the 13th in 2022. Part of why we had to push it back 2 years is because we had already signed a contract for 2021 to be in Washington, D.C. So Washington, D.C. will be our regular pattern in September, and in 2022, we will be going to Puerto Rico. So that's kind of the content of the conference. Now I'm going to ask Tara to walk you through the platform so that you'll have an opportunity to see what the platform will look like for this meeting. Thank you, Tara.
Thanks, Paul. Hopefully, Paul's giving you an idea of our desire to convey, the energy of USCHA, that historical energy that we've always had, but do that virtually. And that's going to be challenging, but we're up for it. So what I'm going to do is just kind of walk you through a mock-up of a virtual lobby. We're actually going to be building out the assets for the USCHA platform this summer, but this is just an idea of kind of what you'd see. So right before the conference, a couple of days before the conference, you'll receive some login credentials. And once you log in, you'll kind of come into this landing space. So this is a space where you can kind of get your bearings. We'll have the labeling that's typical for USCHA. You'll be able to click on here to go to the exhibit hall. We'll probably change this to plenary sessions to go directly to the plenary sessions, or click here to go to workshops. And there'll also be an info desk that's definitely going to be staffed during the hours of the conference. So if there's any questions about navigation or problems that you're having throughout the site, somebody will be there to help you. So here's a sample exhibit hall, which looks kind of fun. So basically, it'll open into the exhibit booths, and it'll open into our premier level sponsors as well as our other sponsors. But then the other booths will be accessible via scrolling. You'll see right here the arrows to the left and to the right to access the other booths, or we'll also have a searchable box where you can enter the name of the exhibitor and jump directly to their booth. So here's an example, a simple animation of the booth experience. You'll come into the hall, you'll click into a booth that you're interested in attending, and you'll actually go through and see everything that they have to offer. And this is basically, of course, this will be customized to whatever they've uploaded into their booth.
Tara, could you hide the GoToMeetings bar so we can see? Thank you.
Thank you. Also, so we know what's important at a booth, same way as in an in-person meeting. You actually you're looking for that engagement. So that can happen through a chat function. You can chat one-on-one with the rep. You can schedule a meeting to meet later with the representative. Or you can also have a group chat or a one-on-one video chat. So we know that the conference bag is definitely something popular at the conference. So while we're not going to have a tangible bag, there will be a virtual conference bag. And this will be a place for you to actually house everything that you've collected throughout the platform. So it can be an actual handout or, brochure from a particular booth or any other assets. So those are things that you can, every registrant will have it, and it'll be downloadable for you once the conference is over. As Paul mentioned, we'll have a virtual jobs fair, and it'll be a place for people who are looking for jobs, as well as organizations that have announcements and positions available to meet up. So it'll be similar to an exhibit booth. There'll be a place to post your resume, as well as a place for you to view announcements. You'll also be able to schedule appointments for interviews or for follow-up. And going into the plenary session environment. So as Paul had mentioned, the plenary sessions are going to be recorded. So once it's time for the plenary session, you kind of go into this waiting area, this virtual ballroom. And once it starts, you'll click the middle screen and it'll expand and the plenary session will show. Also, so Simulive Breakouts, so that's basically the term for the workshops that we're going to have, where it's going to be half recorded, so they're 60 minutes, and half of the session is going to be recorded content, and the other half will be live Q&A. So here's a simple animation of another conference and how they actually access their sessions. So they're in their virtual lobby, they're clicking on auditorium, clicking on the middle screen, and that's actually gonna bring up a list of all the sessions that are available. And you'll see for this conference, they're separated into on-demand and Simulive. And on-demand means they're ready to be, you can click on them, they're ready to be shown. Simulive means that the live Q&A for that particular session has not happened yet. I wanted to repeat that during the, as we approach the conference, we're actually going to be giving some information, some webinars, as well as some toolkits on how to navigate the platform. And there'll be plenty of time for questions in case you have any questions about navigating. So gamification. So for those of you who've attended USCHA before, you know that we normally have a conference app where we have some sort of gamification. We normally have a leaderboard where people can get points for certain things, such as filling out evaluation forms, or going to a particular session, or going to a particular booth. We're going to be building that out this summer and finding a fun way for that to happen. One of the ways that we'll do that is through a scavenger hunt. You'll see in this sample mock-up that we've had hidden an owl within the platform. So the scavenger hunts will definitely be a way where we can hide something within any place in the platform. It could be in a workshop or exhibit hall, in the lobby, one of the networking lounges, anywhere. But we'll give more information about that. And eventually you'll get more points and you can win prizes. Engagement and networking. I just wanted to share that, while a lot of this is going to be, virtual, we do want to have that that face-to-face opportunity as well. So we're going to have lounges. We're definitely going to have our Persons Living with HIV lounge, trans lounge, and youth lounge. And basically what we're looking at right now is for those to be, sort of like Zoom hangouts. So the people can do some informal networking as well as some informal programming. We're planning to have a networking reception, and we're also going to have some social media integration as well. All right, so that concludes my presentation, and I'm going to open it up for questions.
Hi, everybody. While we're waiting for what we'd like you to do is go to the questions section where we had you put your name and to write some questions. But before we go there, Allison, can you talk a little bit about how people should be submitting abstracts and what you're looking for?
Absolutely. So right now our abstract submission process is open. So you can go on to our website, USCHA.life, go to our abstracts tab, and there you'll find information not only about how to submit an abstract, but the tracks that we're recruiting for, a sample abstract, and get our current deadlines. And now our current deadline for abstract submission is July 17th. And we look forward to seeing all of your topics. Next week on July 2nd, we're going to have a webinar to get more in depth about the new track topics. So please join us for that webinar as well and get all your questions answered about the specific details of what we're looking for on those various topics.
And Shantae, tell us how is registration going and how many people have registered? You're muted, honey.
Sorry.
There.
Okay, sorry. Sorry, guys. So we have about 1,800 people registered for the conference right now, and it's still moving quickly.
Thank you. Thank you. I appreciate this. So, Chip, has that given folks some time to put some questions in?
Yes, it has. So let's jump right into them. First question, is there any discussion on other health issues that affect the HIV/AIDS community, such as cancer treatment or dialysis treatment and its impact on the individual along with COVID-19 impact?
At this point, what I would suggest is that if you want to see that, please submit a workshop about that. There isn't something specific except for the intersection of STDs, hepatitis, and HIV predominantly. And we will also look at the intersection with Black Lives Matter. Next question.
Will you have a tutorial for exhibitors?
Yes, we'll have probably multiple tutorials for exhibitors. One of the things that it's important to understand is that, you know, maybe you have been to a virtual exhibit hall before. I have not. And so we plan to attend many virtual meetings before USCHA happens, but we're going to have to learn. And one of the things we're going to have to work with our vendors on is what are the materials that they're going to let people download? Because that's going to be the important piece. Are there things that they can download? For example, we have many condom manufacturers who come. Obviously, they're not going to be able to give out their condoms. And so maybe they're going to be able to give out pamphlets that give people discount codes to order their condoms. And we're going to have to figure out innovative ways to be able for the people who have products to sell to be able to share that information with the attendees.
We're also going to be similar to your service kit that we normally will send out for an in-person conference. We'll give information on how to upload your assets and build out your booth template.
Oh, and one other thing I think it's important to acknowledge is that we are going to be giving away free booths to the 57 jurisdictions that have been prioritized by HHS to end the epidemic. Part of why we chose to give them free booths is because we know that they are distributing the lion's share of the money to community and will have the lion's share of the new job openings. Additionally, we'll be asking them to include any community-based organizations in their health jurisdictions job descriptions so that there will be many job openings available. Next question.
Sure. How far in advance will there be a schedule of topics offered?
Tara?
Allison. Yeah, I know. I'm pointing at you. No, Allison is knowledgeable about the timeline. So our abstracts are due on July 17th, and I know that we're going to be sending out, making the decisions, I believe, by the 1st of August, the first week in August. So we'll have information on the schedule probably by the 3rd week of August.
We should also mention that we would like filming for the workshops to start after Labor Day and be completed by the 1st week in October. And so we have a relatively ambitious schedule in order to make the filming completed by that time.
Very busy summer.
Next question.
I'd also like to point out that the link to submit abstracts is now posted in the chat box, so that will take you directly to the website where you can submit abstracts. Any chance there can be, any chance there can, yes, go ahead, Paul.
Well, I was going to say, could you also make sure to put Tara and Allison and Shantae's email address in the box so that everyone knows how to reach them?
Yep, already did.
Yeah.
Thank you.
Any chance there can be a 50-plus lounge?
That's a great idea. We can do that.
That's a great idea. I think that we would love to do that. Do you want to organize? Who is this from?
It's actually from Diane. It's actually from Diane.
Okay. Well, Diane, of course you know we can do it. Next question.
Would the registration of this webinar mean that we are already registered for the conference?
No, you have to.
No.
No, even though you registered for this webinar, it doesn't mean that you are registered for the conference. You have to go online to USCHA.life, L-I-F-E, to register. And please make sure you do, because as we've noted, in the first 3 days, we already have close to 1,800 registrations, and we are topping off at 4,000.
And I also just posted the link for registration in the chat box, so you can find it there.
Great, thank you.
How will someone know what heterosexual topics will be allowed?
So what will be allowed is in case they wanted to submit an abstract?
So let me, this is what I think you're asking. And the truth is that, you know, we will allow anything. I mean, it's not like we want to restrict it to something specific. We think that this should be a track that gets reviewed by other heterosexuals who are going to be involved in it. And so we're going to try to include members from our community advisory panels to help us determine what are the best abstracts to make sure that we meet the needs of heterosexual, particularly heterosexual people living with HIV.
Yeah, you can feel free to email me any specific topics you have that you're interested in. I'm an advocate for my community, my people. So just let me know if there are specific topics that you have that you want to see in that particular track and institute. Let me know, and I'll be right there advocating for it.
Good. Next one.
I'm wondering and hoping if there will be a session dealing with long-term survivors and how the pandemic is affecting us as PTSD, lack of services, etc.
Not only is there going to be a path, not only are there going to be multiple workshops, there is also going to be an institute that we are working on right now. And so there will absolutely be many topics addressing people over 50 living with HIV. Included in the following track, communities that are hardest hit by HIV is where you're going to find that.
And I'm also hoping that we've met with SAMHSA as well, that they will be presenting some sessions on trauma and mental health as well.
Yeah, we met with them and we asked them, you know, given the isolation that so many of us are experiencing right now, figuring out how we deal with the impact that isolation has on our psyche and how we can manage the depression that sometimes comes with that isolation is going to be very important to all of us. Next question.
Will you be selecting workshops from the abstracts only, or will you be directly programming workshops on topics you've asked specific organizations to do?
We'll be doing both. So yes, we will be using abstracts, but we will also be approaching our partners. And also if there are any gaps, you know, a lot of times in this process, we find or we identify that there have been gaps, like, oh God, we didn't do a workshop on this when it was so critical. And so we often work with our partners to fill what we call gaps or critical issues that didn't get abstracts.
Okay, next question. Will you add more black and brown virtual guests? It looked really white, just something I noticed immediately.
Are you talking about the virtual platform? Yes, we will be customizing it to be casual, to be diverse, and yes, that will all be changed.
I'm laughing only because Tara knows that I complained about this too. I was like,
That's right.
this is not USCHA. This is like APHA. Nothing against APHA. I mean, it's a wonderful meeting, but yes, it will reflect what USCHA looks like. Take my word for it.
Yes.
Next question. Will there be any discussion on affordable housing for individuals living with HIV and AIDS?
Oh, absolutely. Housing is housing is not just critical to prevention and treatment. Housing is critical to to Black Lives Matter. The reality is that housing is about racial justice. Employment is about racial justice. So absolutely. And in fact, what we want to do is look at these topics, from a racial justice lens. And so first, if you are working for a housing organization, I hope you would consider submitting an abstract. But second, please know that if we don't get any, we will absolutely curate it. Next question.
How are you going to prevent Zoom bombing?
So the platform isn't on Zoom. We're recording the workshops on Zoom, but the platform that the conference is being offered will not be Zoom. Now, what does that mean in terms of the security? I'll be honest with you. And so Tara and Allison and Shanti are going to have to
be working on that.
About what that security looks like. Next question.
We'll definitely be researching that over the summer, but also without making it prohibitive. We're trying not to have people have to put in the passwords, which normally is what's recommended by Zoom to prevent it. But we'll be working on that.
Okay, next question.
Next question.
I'm also hoping that there will be talk about how both of the epidemics have hit the rural areas versus metropolitan areas.
I think it's always very hard, and particularly for the rural providers, that we get enough rural abstracts. And so what's going to be really important to all of the folks who work in rural communities on the call is please submit abstracts. The conference is only as good as the abstracts that we get. And so we need good abstracts on rural community, because I know that in the past we haven't necessarily had as many as were requested.
Okay, next question. Are you going to have any discussion about mental health as an HIV prevention method? We know that mental health access and treatment can reduce the risk of contracting HIV and also contribute to HIV medication adherence.
Oh, absolutely. Part of when we were talking about SAMHSA and talking about having, we think that the mental health issues right now, just because of what's happening with COVID-19, are foremost on most of our minds. And so, yeah, we're going to be looking at mental health from a variety of perspectives. And if you have an abstract you want to submit, please consider doing it. Next question.
Will there be a latest on COVID-19 as it affects PLWHA?
Well, we've asked Dr. Fauci to address that in his presentation, but we're hoping that there will be other abstracts that will be submitted through this. We are working with NIH, specifically NIAID, which is the National Institutes of Allergy and Infectious Diseases, and they're going to be coming in and bringing some of their sites to be able to talk to us about what is happening. So yes, that's our hope.
What's the difference between workshops and institutes?
Tara.
Yes, institutes are 90 minutes and workshops are an hour. They're also, institutes are also specific to a target population.
And I think that institutes are also much more interactive. And so it's going to be interesting to see how we make that work virtually. And, I'm a little concerned, and we'll just have to figure it out as we move forward through this. Next question.
Why is heterosexual being mentioned as broad and you break down other genders like Black women, Black trans, etc.? Can it be a topic on Black heterosexual men?
Sure. Once again, First of all, this was an institute. This wasn't necessarily a workshop. If you want to submit a workshop on Black heterosexual men, we would appreciate it, because we understand that there are very unique issues for Black men in America right now, particularly, in light of Black Lives Matter. So I would encourage you to submit, and I would encourage staff to make sure that we have some things that address that.
Yeah, I want to second that, because we typically get very few abstracts on that topic.
Next question.
Is a virtual booth just a place for organizations to display their names?
No, they'll be able to do three things there that I think are real important. Number one, and probably most important, is they'll be able to schedule and have appointments to talk with different participants who are attending the conference. Number two is that they're going to be able to create an online in the sky library of materials that people will be able to download. So it'd be a great opportunity to distribute materials and not have to print thousands of copies. Number three is that you'll also have the ability in your booth to show videos. And so one of the things that we want to do is, if you have videos, you'll be able to play those. So it's more than just your name. However, we should also say that a lot of companies are trying to, and agencies are trying to figure out how to get value out of this. This is a new idea to us, and so we're going to be going to some virtual meetings over the next couple of months and seeing what works, and hopefully pulling away some of the best practices for our exhibit hall.
And exhibitors are also going to be staffing their booths during the live hours of the exhibit hall. So they'll be there to chat directly with people who are attending.
Next question.
Will there be workshops to address best practices in providing virtual case management?
Yes. I mean, that's kind of the whole intent of this meeting, is to talk about how are we providing services in the COVID-19. So I can't imagine that won't be critical. And if we don't get abstracts, that we will curate for them.
Next question. Will there be a virtual bulletin board?
Ooh, I don't know. We haven't thought about that.
I don't know. We haven't talked about it. We'll make sure, see if we can have it.
Yeah, it's a great idea. Next question.
Will there be conversations about the importance of using people living with HIV and ending the epidemic?
Oh, absolutely. Absolutely. There's no way we can do this meeting, and there's no way we can end the epidemic without making sure that we work with people, with having people living with HIV in leadership positions. I think that is one of the critical pieces that Black Lives Matter has shown us, is that you have to have the communities that you're trying to reach at the table. And so absolutely, please know that people living with HIV are core to any solution to ending the epidemic.
We have two more questions in the queue. In the past, there was an app that helped us through the program. Will we have an app this year?
No, there will not be an app this year. Everything will be online, and so you'll be able to look online to look at it. So this is one thing that I do want to say to people, because this is the thing that we don't know. We don't believe that people are going to be willing to sit in front of their computer screens for 8 hours a day. We think that that's just much too much, and it's going to be overwhelming. And so part of what we want to do, is part of why we wanted to record pieces, was so that people could see them later on. You should know that the meeting, because we're in multiple time zones, is going to have to start later and end earlier than the typical USCHA would do. So we're looking at starting at noon on Eastern time, or 9 o'clock Pacific time, and we're looking at ending at 6 p.m. Eastern time, or 3 p.m. Pacific time. And partially why we're doing that is to be able to accommodate the multiple time zones that are in place, and with people, giving people the knowledge that even if they missed it during that time, they can go back to it. Next question.
I want to add to that question that we will have a program book though.
Yeah, there will be an official program book with ads. So if any of you want to take an ad out in the program book, we hope you will do that. Listen, I got to sell the sucker. Anyway, we're gonna have registration fees. Okay, so next one.
Yeah, we have 2 more questions left. One is, will you have any workshops on law enforcement reform or policies?
Ooh. You know, so let me say once again, new idea, hadn't thought about it. Absolutely, if you submit something, we definitely, you know, I think that we cannot talk about Black Lives Matter and not talk about police. We cannot talk about Black Lives Matter and not talk about how it's going to impact the delivery of HIV services. And so I hope you submit that abstract, and I look forward to going to that workshop. Next question.
And this is the last question we have right now. Will you be addressing issues of Black, Latinx, HIV positive in a Spanish track?
So what's going to happen in the Spanish track is that I believe it's this week, a survey in Spanish is going out to Latinx providers, asking them to prioritize what they believe are the important workshops for this track to be offering. Based on the survey of the Latinx providers, we will then curate a series of workshops in Spanish to address the priorities that were identified in the survey. If you are interested in being a part of that survey, does anyone know Damien's email address?
Yeah, I was about to say we should put it in the chat box. So I think his is longer. So yeah.
So this is being coordinated by Damien, who at NMAC, and what I would suggest is that you reach him to make sure you're both part of the survey, but also to give some feedback and input on what you think the Spanish language track should include. So I think that's it, Chip. Anything else?
We have one more question.
Okay.
Let's see, sorry. 2 more questions, actually. People still have a question. So will there be a discussion about modernization of HIV-specific laws?
And criminalization, absolutely. HIV criminalization is going to be a critical issue. Both it will be discussed in a couple of places in the HIV policy track, and so once again, we hope that all the people who work on criminalization or anti-criminalization will submit abstracts for the policy track. We also know that it will be addressed in the People Living with HIV Institute.
And the current last question we have, will question and answer sections of each session be recorded for review later?
Yes. Good. Well, thank you. Thank you all so much for joining us. Tara, any last words?
No, I just wanted to speak for some frequently asked questions for those of you who've registered before for the conference. We will be sending out, I believe that Shantae had sent out a communication about what to do with your registration. And Shantae, do you want to speak about that?
Yes, so early this morning, I sent out an email about your registration. I also put my contact information in it. So if you did register for USCHA Puerto Rico and you haven't received an email from me, please reach out to me. It's sgray@nmac.org, and I will make sure that you're taken care of.
And those options are either to get a conference refund, or to apply your registration to next year, or to donate your registration fee. Also, if you've made a reservation at one of the conference hotels, the Sheraton or the Caribbean Hilton, they will be canceling your rooms and refunding your deposits. So if there are any other questions about that, feel free to contact me directly.
So, Shantae, any last words?
No, just thank you. And we're super excited for this virtual webinar that's coming up.
Allison?
She expressed my sentiment. It's my same sentiment. So thank you all for being patient with us and working with us. And we look forward to having a very exciting USCHA virtually.
And we're also going to have an abstract webinar next week So you have any questions about submitting an abstract or just learning more about the individual tracks, please join us on July 2nd.
Yes.
Yes.
Okay, bye everybody. Thank you so much. We will talk.
Yeah.
Bye.